So who is involved in a surgery here?
Well, obviously there's the patient. So we can't do the show without them. There's going to be me. I'll be the doctor that's doing the anesthesia, getting everything numbed up, and then also doing the procedure. But then around me, we've got a team that helps to make my job a lot easier and make things a lot smoother for the patient. So
Who assists in the surgery?
so Ty, you're obviously going to be there. You're going to be the center spotlight for most of the day. When we're not focused on the patient, we'll obviously be focusing on you. But you'll be there because the instruments need to be cleaned and make sure everything's nice and sterile. Make sure the sterile field is maintained during the surgery. And then also just assisting me to help make the flow of the liposuction go smoother. We'll have a combination of some nurses there, so either Amy, Leslie, Jennifer, they're going to be there to make sure that the patient's feeling well, that we're trying to keep them laughing and keep their mind off of what I'm doing. But for the most part, you'll have a team of about 4 people that are working with you throughout the day to make sure that you're comfortable before surgery, that we get all the necessary paperwork done, and that you're comfortable during surgery and have all your questions answered about the aftercare afterwards.
I like that we all get to meet the patient beforehand. We all get to chat, and I think it probably does a lot in terms of patient comfort. They get to see everybody and chat
Right.
with each of us individually beforehand.
Yeah, I think you'll see that like some patients when we do the virtual consults or like the in-person consults, they think the tour is kind of goofy.
Yeah.
But I think that it's a really important part because surgery is a really anxiety-inducing and nerve-wracking process, and kind of seeing it for the first time desensitizes it, and it's not like this sensitive environment when you're in here for the consult. So you can kind of like feel it out, look at the space, get to meet everyone, so that when you are a little doped up and you're a little bit nervous, at least you've got some familiar faces and you know that the people that you've met before are going to be there with you through your surgery. Yeah, and I think that it's nice also being able to have like a loved one or like a partner in there with you so that they can kind of like see what it is, because you don't want someone to like play into your nervousness. You want them to be like, oh, it's okay, like I was there with you, we saw it, we know what it is, you're going to do fine. I think that kind of helps put both the patient and their partner's minds at ease as well.